Importance of managing hyperglycemia for diabetes mellitus, type 2, presented by Margaret Brown, Matt Morelli, and Morgan Dennison. What is type 2 diabetes mellitus? Diabetes mellitus type 2. Diabetes is a disease where your body has problems regulating blood sugar. The pancreas does not make enough insulin, and the tissues are insulin resistant. High blood sugar levels can lead to health problems. Type 2 is also called adult onset diabetes. Some risk factors include obesity, high cholesterol, high blood pressure, family history, inactivity, and age. What is hyperglycemia? Hyperglycemia means high blood sugar. This occurs when the body has too little insulin or when the body cannot use insulin properly to break down sugar. Levels greater than 125 milligrams per deciliter while fasting, which means no food for 8 hours, or levels greater than 180 milligrams per deciliter 2 hours after eating both indicate hyperglycemia. These levels are ADA recommendations and may vary per person. As you can see on the infographic below, some symptoms of hyperglycemia are dry mouth, increased thirst, weakness, headache, blurred vision, and frequent urination.
The dangers of not managing hyperglycemia. Ketoacidosis. When hyperglycemia is not treated, a condition called ketoacidosis, which is a diabetic coma, can occur. Ketoacidosis occurs when the body does not have enough insulin. Without insulin, the body cannot use glucose for fuel, so fat is broken down instead for energy. When fats are broken down, ketones are produced. The body cannot tolerate large amounts of ketones and will expel some in the urine. Not all of the ketones can be released, so they build up in the blood, which can lead to ketoacidosis. Symptoms of ketoacidosis include shortness of breath that smells fruity, nausea and vomiting, and very dry mouth. And as seen on the graphic, some other initial warning signs of ketoacidosis are thirst, high ketone levels in urine, frequent urination, and spiked blood sugar.
Diabetic neuropathy, a type of nerve damage that can occur in patients with diabetes. It is caused by high blood glucose levels and high fat levels in the bloodstream over time. This can be prevented by proper management of blood sugar. Some symptoms include a tingling sensation in your feet, pricks and needles, a burning sensation, numbness, increased sensitivity, and your wounds heal slowly. So what are some neuropathy consequences? Diabetic neuropathy commonly leads to loss of feeling in the foot, so you cannot tell when you have injured yourself while walking barefoot in places like the ocean or when blisters or sores form due to excess walking. Unable to realize your injury, it remains uncared for and has the potential to become infected and not heal on its own due to lack of blood supply. This later causes gangrene, which is characterized by the death of tissue from infection or lack of blood supply. When gangrene has set in and the infection is still ignored, it has the potential to spread to the rest of your body and turn fatal. In order to save the patient, amputation of the limb is then required. In the top right, you can see a breakdown of a divascular foot and the different levels and how originally there's no ulcer, it forms, becomes deeper, turns into an abscess, and then becomes gangrene. And then usually you have to get your foot amputated at that point or it'll spread to the rest of your body. So, how should you care for your feet? After finding out the dangers of not caring for your feet, here are some ways to take care of them so they do not get infected. First, you can check your feet daily for any damage, especially after long walks. Second, you can wash and thoroughly dry your feet every day to keep them clean. Third, you can smooth out any corns and calluses in one direction to prevent buildup. Fourth, keep your toenails adequately trimmed. 5, always wear socks with shoes. 6, protect your feet from excessive heat and cold. 7, have your feet regularly checked on by the doctor.
Managing hyperglycemia. At-home management. There are a variety of medical and non-medical methods to treat hyperglycemia. Monitor your blood glucose levels throughout the day. Don't forget to take your prescription drugs as ordered by your doctor. Eat a healthy diet and avoid high sugar foods. Pay attention to the carbohydrate amount in your foods, as that is also a factor for blood glucose level. Incorporate daily exercise into your life. And if your blood sugar is very high, check your urine for ketones using an at-home test. If ketones are present, do exercise, but do consult your doctor. Therapeutic options. It is important to see your PCP to discuss treatment options beyond home management. One option is insulin injections. Another is oral anti-diabetic medications. Metformin and Januvia are common drugs used to treat diabetes. They both lower blood glucose level. Here are our references. Thank you for listening.